Good morning everyone. I am P.Mythili, Assistant Professor, Department of Nutrition Dietetics, KSR College of Arts and Science for Women. Today we learn about nutritional assessment and diet counseling in clinical setting. So firstly, what is the difference between nutrition screening and nutritional assessment means? Both are same indicator to usually evaluate the nutritional status of a person. So nutritional screening is a simple process compared to the nutritional assessment. Both screening and assessment used to require the basic information like dietary intake, anthropometric assessment, clinical finding and biochemical data. So firstly we see about the assessment tools. There are so many types of assessment tools are there. I here put into some of the important tools. First of all, nutrition focused physical examination means it is a simple and easiest assessment tool to evaluate the body conditions in our body, how muscles are loss and fat depletion based on the physical examinations we may determine. Evaluate edema. Edema means excessive fluid accumulation in our body, and also examine skin, hair, nail and oral cavity. Nextly, body mass index. It is the basic important tool for the nutritional assessment. It also helps to determine the person's underweight, overweight, normal and obesity. By assessing body mass index, we use it to assess the formula based method. The formula BMI equal to weight in kg divided by height in centimeter. Also used other anthropometric assessments like mid upper arm circumference, waist hip ratio, waist circumference for children. These are other methods of assessment tools to evaluate the growth, body composition and nutritional status. And move to the bioelectrical impedance analysis. These are also important assessment tools to evaluate the fat percentage in our body. So this assessment tool used to help the measure muscle mass and body water. And we know about the hand grip dynamometer. Dynamometer used to measure the muscle strength and function, also used to determine the functional status and nutritional needs of the persons required. And lastly, skin fold thickness is used to measure the fat stores, especially in the part of tricep, bicep and subscapular region, to estimate the fat body percentage in our body by the skin fold thickness method. And we move to the clinical assessment. Clinical assessment tools are same as the previous topic. It examine the hair, eyes, skin, lips, tongue, teeth and gum, nails. These are the clinical assessment to use it to evaluate the person's conditions. It is a simple cost-effective method for evaluating nutritional status as well as help to detection of malnutrition and deficiency disorder. So the common deficiency signs like pale conjunctiva, which means eye problem, it leads to iron deficiency, anemia. Nextly, bite or spots. It's also same as the eye disease. It may cause by the deficiency of vitamin E. And the bleeding gums, it may cause deficiency of vitamin C. Dry skin, essential fatty acid deficiency. And the nails are in spoon shaped, it may cause by the iron deficiency. So these are the visible signs to examine the person's condition with the clinical examination method. Nowadays, preschool children are highly vulnerable to nutritional deficiency. So the same parameters are applied to here. Some assessments include physical appearance, growth measurements, clinical signs of deficiency, conducted under the guidance of your medical supervisor. So these are the basic clinical assessment tools. Now we move to the biochemical assessment. So the biochemical assessment tests are based on the laboratory test like hemoglobin, serum ferritin, serum albumin, blood glucose, lipid profile, vitamin D and B12 levels. These laboratory tests are used to evaluate nutritional status and detect the particular deficiency of a person. So firstly, see about the deficiency conditions. If person has a diabetes mellitus, means the test used by the blood glucose HbA1c method. If cardiovascular disease means we use it to assess the lipid profile. If kidney disease means we use it to assess the blood urea and creatinine level in person's body. And the liver disease means we have so many liver functions test. It may detect the particular stage of liver disease. The analysis of biochemical report, how to evaluate means we compare the test values with reference range, identify nutrient deficiency, assess nutrition adequacy and the risk of the disease may happen, and plan appropriate diet based on the person's condition and health care. Screening, assessment, clinical examination and biochemical test are the important tools for evaluating nutritional status. It also identify the person's malnutrition, nutrient deficiency, and disease-related health problems. Proper assessment and time management may improve the patient care, support recovery, and promote overall health and well-being. Thank you.